Hi friends. So I'm always very excited whenever I interview a student from Maulana Azad Medical College, being my parent college. I don't know why I have got some special affinity for the parent college, but I think that everybody has some affinity for the parent college. So with this, today in the studio I'm sitting with Dr. Archit Garg, a proud Malanian and who has scored rank 203 in the Neet PG 2020, and along with that he has also scored Delhi rank 8. A very big congratulations, Archit.
Thank you, sir.
So how does it feel to get rank 8 in the Delhi amongst like the cream and such a great rank in the NEET?
Sir, in the starting I was not thinking that I will get such a good rank, but as the internship proceeds I thought that I would be able to do it, but in the whole year there was lots of ups and downs. Sometime I was thinking that I will secure very good rank, sometime I like I will not be able to do it, I have to drop anyhow, then I should enjoy with my friends, leave studies, but anyhow I have to get me going. Then I was, as the year proceeded, in the end of the year I was able to cope up, and what I have studied in last 5 years I was able to recall them in my exam, and I'm thankful to Almighty God that was able to get such a good rank. And want to thanks DBMCI family to help me, to who nurtured me like their child so that I can get such a good rank.
So अर्चित मुझे लगता है कि ये सब नॉर्मल है, मतलब दिस इज अ नॉर्मल पार्ट फॉर एनी मेडिको. ये अप्स एंड डाउन्स तो आते रहेंगे ना, तो मतलब दिस इज गोना हैपन कि कभी आपको लगेगा हाँ यार मैं बहुत अच्छा पढ़ रहा हूँ और मेरी बहुत अच्छी रैंक आएगी, और सडनली नेक्स्ट डे ऐसा हो जाएगा अरे यार भाई ये क्या हो गया, मैं तो कुछ भी नहीं कर पा रहा ना. दैट इज डेफिनेटली देयर. मुझे लगता है कि वो परसिवरेंस की हाँ नहीं कोई बात नहीं, जब भी वो टाइम आया और अपने आप को आपने उसको फोकस किया इज द वन दैट इज देयर. So, for the people who are watching us, Dr. Archit joined us when he was a second year MBBS student at our Delhi Foundation batch, and then he continued with the third year and the final year. So, let us hear from Archit ki what was his strategy, किस तरीके से he utilized the course, second year में क्या किया, third year में क्या किया, final year में क्या किया, और फिर internship में किस तरीके से पढ़ाई की so that यहाँ तक पहुँच पाए.
Sir, I joined DBMCI in second year. Then in that year I studied 4 subjects of second year itself, because at that time it is very premature to think of my PG preparation, so I didn't put much pressure on my first year subject. So I only studied 4 subjects: path, pharma, micro and forensic medicine.
Okay.
Sir, and at that time I didn't practice any MCQs. It was only just for my passing the prof. It was basically
just you read the subject.
Yes, sir.
Okay, so that you got the knowledge of the subject.
Basic purpose was that I can pass my prof with good marks and I have the good knowledge of my subject.
Okay, great.
Then when the third year starts, it usually trend in MMC that all people start studying for their PG preparation in third year. So
it was not there during my time. I was one of the few students who started in third year, and then later on like पिछले 5-7 साल I think ये trend है कि
third year से अब तो सर 90% लोग join करते हैं. Then I did my whole of the 3 subjects of the third year and 9 subjects of the final year. At end of as third is comparatively free because subjects are light, so I was able to make all the notes of my subjects.
तो बेसिकली 12
प्लस
और
4 16
हो गए.
16 सब्जेक्ट्स के नोट्स I have
to finish 16 subjects and completed your notes.
Yes, sir. Okay. Then my final year started. As final year is as itself a lot of course, it was not possible to do my
all the subjects.
But somehow I realized that it seems impossible, but if you start, it can be done. As we say that work started is half done. So I thought that I will not just leave my PG preparation, I will do it side by side. So I started thinking that my anatomy is very weak, and next year as my internship is usually the trend is very heavy in MMC, so I will not be able to join any class in my internship, so I have to complete my notes of at least anatomy, because Dr. Ashwini Kumar is the best teacher in anatomy. He I can't explain what he taught us so well, and his notes was very crisp and to the point, so that if 10 to 12 question comes in the NEET exam, they all be at least 95 to 97% question will be from his notes. Then Dr. Jay Arora sir, he didn't taught us in our third year fund, but I was I used to hear from my seniors that if you are able to do surgery from his notes, it will be best for you. So as my first posting in the final year was gynae, it is comparatively light posting. So I attended around 9 to 10 classes of Jay Arora sir in my in the week of
final year.
In the final year.
Okay.
Sir, then we become busy with our schedule of the normal final year. But then again, I realized that my path is also not so good, because I was very bad at hemat portion, specifically, to be specific. I never came to realize that it is AML, CML, ALL, AML, it's chronic, it's acute. I was very weak basically. Then I came to know about Dr. Praveen sir, who was not there at the time of the second year. Then I attended his classes along with my friend. Nobody wants to attend classes in the month of June, July, when so much pressure is there, and all people know that surgery was bit
पता नहीं पास हो पाएंगे कि
bit terrifying for us कि
सप्ली रेट भी बढ़ता जा रहा है।
हाँ सर, तो सप्ली सर्जरी के डर से हमने पैथ बहुत लोग ज्वाइन नहीं, मैंने बहुत लोगों को रिक्वेस्ट की कि वी शुड ज्वाइन, बट कोई माना नहीं. बट एक मेरा फ्रेंड राघव गुप्ता, उसने ही said both of us joined. We used to come together and we attend the class and then leave. So path, along with the final years, I was also focusing on my NEET exam, which I have to crack anyhow next year. And luckily, in our college there were senior medilectuals. I got some online portal MCQs. I practiced at least 6-7 subjects MCQs that year, and whichever topics were not covered in my notes, I added them in my notes itself. I still remember my center were from the 12th October 2018. Last MCQ I practiced was 8 October 2018. Some people will not believe me, or they will.
I mean, there is nothing to believe, or you are speaking from your heart.
But so I still remember the dates because I am telling the truth. Many people said कि तू बेवकूफ है, कि अब कौन मतलब सर्जरी ऊपर आ रही है, फेल होने का डर है, कि पहले पास हो जाओ, नीट तो अगले साल देखी जाएगी. बट मैंने सेट किया नहीं, पास तो मैं हो जाऊंगा, बट नीट क्रैक करना, आई हैव टू क्रैक एनी हाउ.
तो अर्चित, गोइंग बाय दिस वर्ड, दिस इज व्हाट आई कीप ऑन सेइंग टू एवरीबॉडी, कि आपने फाइनल प्रॉफ में कितने नंबर आए थे, आपके सर्जरी में कितने नंबर
सर
आए
मुझे
थे, आपसे लाइफ में कोई नहीं पूछने
सर मुझे अभी भी याद नहीं है, मुझे उस साल भी याद नहीं था, क्योंकि ऐसा सप्ली रेट वाज हाई, माय फ्रेंड्स गॉट फेल्ड, आई वाज इन टीयर्स, और मुझे अपने मार्क्स ये भी नहीं पता, कि अभी भी नहीं पता.
बेटा तेरे को नहीं, आगे 5 साल बाद किसी को भी नहीं पता होंगे ना, तेरे से कोई पूछने वाला. बट किस सब्जेक्ट में आप पीजी कर रहे हो,
ये सारी दुनिया
ये पूछेगी नहीं, ये हमेशा तेरे साथ रहेगा.
yes,
सर्जरी में सिर्फ एक ही चीज रहेगी, पास या फेल.
yes,
गोल्ड मेडल मिल गया, चलो अच्छी बात है, दैट विल अगेन रिमेन विद यू. बट अदरवाइज कि आप चाहे 51% मार्क्स से पास हुए, चाहे आप 71% मार्क्स से पास हुए, कोई नहीं पूछने वाला. और हमें पता है मेडिकल कॉलेजेस में पास होने के लिए सिर्फ नॉलेज नहीं चाहिए होती. है ना, जो लोग सप्ली आती है, इसका मतलब ये नहीं होता कि सारे के सारे डिजर्व कर रहे होते हैं, है ना. जो लोग पास हो रहे होते हैं, ये भी नहीं है कि वो भी सारे डिजर्व कर रहे होते हैं ना, वी ऑल नो. But chaliye, let's not go into that. Let's focus on to the PG entrance exam. So basically, in the final year, you completed whatever lag that was there in your subject.
So that before my internship starts, I have the
19 subject तुमने एक बार complete कर दिए.
Notes हो मेरे पास उनके.
तुमने 19 के 19 subject attend किए. Any special, you already mentioned Dr. Ashwini, you already mentioned Dr. Praveen, Dr. Jay Arora. Any other faculty that is associated with DBMCI that created, sometimes some faculties creates an impression in your brain?
Sir, I will like to go year wise. Dr. Ashwini sir, as I said, he's the best teacher anybody could have taught anatomy. Then going to second year, Dr. Praveen sir was the very, very good teacher. He taught us very well. Going to a third year PSM faculty was very nice, and Dr. Sanjay Aggarwal ENT faculty was also very good. Going towards final year, sir, especially you are the only person who have ever listened to how radiology lecture has to be taught, should be taught, and how we have to see the images. Before that, it was just like black and white for me. But after your lecture, I came to see hyperdense, hypertense,
समझ आ सकता
कि अब पता चल रहा है
दिखती है वो
कि
चीजें
हो
क्या
क्या रहा है. पहले तो काला अक्षर भैंस बराबर, मतलब कुछ भी नहीं समझ आता था. उस सर डॉक्टर तमीम साहब, आई वुड लाइक टू थैंक हिम फ्रॉम माई हार्ट. बहुत लोग बहुत अलग अलग इंस्टीट्यूशन ज्वाइन करते हैं, बहुत मोटे मोटे नोट्स बना देते हैं, बिकॉज मेडिसिन माई फेवरेट सब्जेक्ट. मैं खुद बहुत बड़ा फैन था मेडिसिन का शुरू से ही. सो आई स्टडीड मेडिसिन इन डिटेल एंड नोट्स वर दैट बिग. एंड when I attended sir's lecture, it was like just like 320 330 pages. I myself doubted sir ki how can
medicine such a vast subject,
such a vast subject, 330 pages mein sir covers whole the things. And plus point is that sir will teach many pharma drugs which are new in the field also. मैंने कहा कि यार लोग इतना पढ़ के भी मेडिसिन नहीं कर पा रहे, सर 300 पेज में कैसे मेडिसिन की गारंटी ले रहे हैं. Okay, in the final year I read that but notes and passed my exam. When my internship starts, as internship is busy, but I was not able to read that note. So I said कि यार I will, सब लोग तमीम सर को इतने रिस्पेक्ट से बोलते हैं कि सर के नोट्स बेस्ट हैं, वही पढ़ लो, बात खत्म. मैंने कहा अब मैं वही कुछ तो बात होगी, मैं भी वही करूंगा, मैं कुछ भी और नहीं पढ़ूंगा. कि I will go and stick with that notes only, nothing else. Nothing means nothing. Not even a single line, single word, single drug. Nothing. Finish. मैंने सर के कॉपी के 320 पेजेस है, मैंने 10 पेज छोड़े थे. 10 पेज मैंने छोड़ दिए बिकॉज इंटर्नशिप में मतलब कुछ भी था, मैं नहीं पढ़ पाया. उसमें से मेरे 2 क्वेश्चन गलत हुए. मुझे आज भी वो दुख देता है कि मैंने 10 भी पढ़े होते, मेरी रैंक हो सकता है 20-30 और आगे होती. और वो सर के नोट्स में ऐसे लिखे हुए हैं बिल्कुल. सो आई वुड लाइक टू से कि अगर किसी भी बंदे को डाउट है मेडिसिन के रिगार्डिंग, तमीम साहब सर से अच्छे नोट्स किसी भी टीचर के नहीं है. इसमें कोई मतलब मैं दिल से बोल रहा हूँ कि बिकॉज जिस सब्जेक्ट को मैं नहीं पढ़ पाया, मुझे लगता था कि यार, क्योंकि जब भी मैं ऑनलाइन कोई भी टेस्ट देता था, जो कि मेरा फेवरेट और सबसे स्ट्रॉन्ग सब्जेक्ट था फाइनल ईयर में, मेरे इंटर्नशिप में कोई भी जीटी में 50-40% क्वेश्चन सही होते नहीं थे. बिकॉज आई स्टडीड, whenever I studied that based notes, I was able to complete only one system in 2 to 3 days. When I studied notes of sir, I was able to complete his whole copy in 2 to 3 days. Because it was...
See, exam is all about recall.
Yes sir.
It's all about recall. It is never about कि आपने कितना पढ़ा है. वो चीज पढ़ने का क्या फायदा जो एग्जाम में याद ही ना आए. मतलब मैं तो बहुत ही ज्यादा इस बात को बिलीव करता हूँ कि जो चीज आपको एग्जाम में याद ही नहीं आएगी, उसको पढ़ने का क्या फायदा. तो ये what I am also very emotional on this particular part because this is what happened with us also when I was a student. And सब तब Dr. Tamim was not so famous as he is today. तो मेरे एक सीनियर थे, वेरी फेमस ऑर्थोपेडिक सर्जन, उसने मेरे को बोला, रजत ये बैंगलोर के बंदे आते हैं, इनका एक क्लास अटेंड कर लेना. तो मैंने अपने कुछ 20-30 बैचमेट्स को मिला के उनका क्लास एक अटेंड करा. और जब मैं अपना एग्जाम दे रहा था तो मुझे आज तक याद है कि सर के नोट्स और सर की स्टेटमेंट्स ना मेरे को इको कर रही थी मेरे दिमाग के अंदर कि हाँ ये चीज सर ने वहां लिखवाई थी. और ये एंड व्हाट यू सेड राइटली ना कि 10 पेज छोड़कर आए थे, उसमें से 2 क्वेश्चन आ गए. सो दिस हैपेंड विद ऑलमोस्ट एवरीबॉडी. सो दैट द टेक होम मैसेज इज दैट प्लीज ट्रस्ट ऑन द पीपल. वी नो इफ वी आर टीचिंग यू, हमें पता है आपको कितना पढ़ाना है, क्या पढ़ाना है, और मोर इम्पोर्टेंट देन दैट कि आपको वो याद कैसे रखना है सो दैट यू कैन रिकॉल इट इन द एग्जाम. तो एनी अदर पॉइंट दैट यू वांट टू मेंशन?
Sir, Dr. Jay Arora. In our third year, I attended surgery here only, but in the final year, I decided that I will do whole of my surgery from Jay Arora, sir. As I was seeing in the last exam, because I was always throughout my MBBS, I was always a who was serious student, who people say who was concerned about his studies. As I was in touch with the exams, I was seeing that trauma portion is becoming important day by day, because that is a point only, because in the India so much RTAs happen, and it is very important that at least every MBBS doctor should know
basic trauma management.
what I should do when such patient in such conditions comes to me. And Dr. Jay sir taught us trauma for around 2 days, and I was like कि आज हाँ अब मुझे कोई पेशेंट दे दो, मैं उसको बचा लूंगा, मैं उसको मरने नहीं दूंगा, कि I will do the basic things that he requires, and then ultimately someone will take care of further his requirements, but मैं उसको मरने नहीं दूंगा, और उसको क्या basically उसको क्या चाहिए, what he needs, primary.
The paper was all about that only.
And the NEET exam was like कि, and I'm not bragging, but all people were saying कि NEET का exam बहुत लंबा था. मैं सच बता रहा हूँ, I was able to complete my exam in 2 hours 20 minutes. There were about 70 minutes left when I was done with my exam. So then I went, I like, what will I do 70 minutes now? So I went to the washroom and just passed 5-10 minutes. Then I came back. Then I was like, just paper दोबारा देख लेते हैं कि कम से कम दुख ये नहीं रहेगा.
You are slightly, I will say कि different in that manner, but for 99% of the people, yes, the paper was slightly lengthy. Even in fact,
I was able to complete in 2 hours 20 minutes.
You must be a fast reader, probably, that I will say.
Yes.
You are a fast reader. Then.
Yes, sir.
Otherwise, the paper was definitely lengthy this time. Lot of students who have scored very, very great ranks also, they have also said कि वो वापस नहीं आ पाए पेपर पे. They were able to complete it on time, but they were said definitely कि you are a very, very fast.
I was like, मैं कहा यार
कितने क्वेश्चन अटेम्प्ट किए?
Sir, in single attempt when I मतलब total 298.
298. What is your recommendation to the students कि कितने attempt करना चाहिए? ज़्यादा attempt करना चाहिए या कम attempt करना?
Go for a kill.
Go for a kill. Yeah, exactly. क्योंकि अगर कम attempt करोगे तो negative तो कम होंगे, but positive भी तो कम हो जाएंगे.
Yes, sir.
Okay. Archit, what about the vibe session?
Sir, vibe session was very good, because important of I think images are very high yielding and very scoring, because once you see an image in your life, you will 99% you will never do a question wrong on image, because in that options come very different. They will not be relating to each other, they will be very different. For example, if an image is showing, it will be like tinea, lupus, so they will not be related to each other anyhow. If you have seen any image anywhere, in any book, in any page, you will, once you see, your image will strike in your net, I have seen it, and you will do that question right. And same happened with me also. When I attended Vibe, we see all the important images which are important, for which all the faculties think that these should be known to a MBA student, then they can come our NEET exam. So I attended Vibe session, and it was very helpful, because whenever I think that in this NEET around 80 plus question come from are images based.
Yeah, exactly. I feel maybe more than
maybe
that.
More.
Yeah.
But I can say that around maybe 75 plus questions are right. My 75 plus questions are right.
Wow.
No image question is wrong.
Wow. Wow.
No image question is wrong.
Wow.
Now
the conceptual knowledge was so strong that you tend to recall that and you tend to remain that.
Yes.
Archit, your internship was very hectic.
Yes.
I know that in NAMC the internship is very hectic. And you had a very smart plan of reading the subject very, very quickly.
Yes.
I believe one of my senior told me that the more number of topic, more close to the exam you can revise, better will be your rank. So what was your that 20-day, 10-day, 20 subject strategy? Can you just elaborate more on that?
As the norm, all people say that we should be able to complete our syllabus by July or mid-August. Because as the year proceeded and schedule of my posting was such that I was not able to complete my syllabus. I was able to complete my syllabus by mid-September. Then I started my revision. Then before AIMS, I was not able to even complete my second revision. Then AIMS paper happened, and 1-2 days all people have the same. They will agree with me that all people who have studied, they will waste 1-2 days thinking about the exam. Then after 5-6 days, result came. Then same happened with the PGI. Then in the month of December, I thought that this month I will not read anything new. Anything means anything new. And what I have studied a lot. I know the things. Basically, mistake what I am doing is that I am not able to recall, and I'm usually confused between the two options. And as someone has said that no question is silly, and you never do silly mistake if you are thorough with the subject. If you are weak with the revision, then you do silly mistake, and then you say that paper was easy, I made my silly mistake. But if you have revised well, you will never say paper was difficult, paper was easy. Silly mistake will be very less. So I thought that I have to do such thing that I can revise my whole syllabus in last 10 to 12 days. It was day of 26th December. I decided that there are 10 days left. I have to complete my whole syllabus once again in 10 days. As some say 19 subjects, some say 20 subjects, oncology included. So I started my revising my subject one by one on 26th December. And I thought that I will not read even a single line written by me in my notes, except that is taught to me by my teachers. I thought that the person who has spent already 20 years of his life thinking what 100 pages are important for me, and I being to experience of one experience, how can I write 100 pages myself and make it 200 page notes, and it will be nearly impossible to read all the subjects.
So basically you thoroughly revised only the content written by you in the class?
Only the,
and that's all?
Only the content. Not even a single word. Okay. Not even a single word. And I usually studied my last days I was basically all tired after studying so much in my past 1 year. I thought that I'm not able to study. So I thought that I will not go to library, I will not go anywhere, I will study in my room. But in room studying is difficult, you feel sleepy. So I thought that I will study in my friend's room. My friend used to stay, I used to stay in 7th floor, and my friend used to stay in 6th floor, and one friend in 3rd floor. So I usually studied 2 to 3 hours in their room. I used to carry one copy, sit there 2 to 3 hours, I will complete that copy and return back. And they will
change the copy and
they will judge that how can you revise whole subject, whole copy in 2 to 3 hours. I said that this much is of my copy, but teacher has taught only this much. So I have to
study only that much.
Only that much, and that much I have already studied, because in my prof usually I don't read the standard textbooks, as all people have the saying ki Harrison नहीं पढ़ोगे तो medicine नहीं आएगी. But I didn't study. I usually studied the notes, my notes only. तो मैंने अपने notes 4-5 बार पढ़े होते, मुझे पता था उसमें क्या लिखा है. मुझे अगला शब्द पहले पता होता था कि
revision is the key broadly. अगर इसी बात को हम strength कर रहे हैं कि fear of missing out में नहीं जाना, FOMO में नहीं जाना, सिर्फ अपने जो खुद के बनाए notes हैं, जो आपको टीचर ने पढ़ाया है, उस पर ट्रस्ट करो, उस पे एक अच्छे वाला ऑनेस्ट ट्रस्ट करो, बिलीव इन गॉड, बिलीव इन योर सेल्फ, कि भाई जो आप कर रहे हो, आपको जो गाइड करने वाला है वो ठीक है, और उस पे अपने एफर्ट्स डाल दो, एंड द रिजल्ट विल बी डेफिनेटली एज पर योर एक्सपेक्टेशन.
सो एज थिंग्स चेंज, आई वाज एबल टू रीड whole of 22 copies in my last 10 days, and usually studied in my friend's room mostly. As I'm
दे रहे हो ना उनको?
हाँ सर, पार्टी दे रहा हूँ. मैं उनको नाम में लेना चाहूंगा. माय फ्रेंड्स सागर, संयम, चंदन. मैं इनके रूम में पढ़ा हूँ. मैं कॉपी लेके जाता था 2-3 घंटे में. वो मेरे को जज भी करते थे, यार तू कि हमारे को बेवकूफ बना रहा है कि तू कॉपी खत्म नहीं कर सकता. मैं कह रहा हूँ भाई पूछ लो,
उनको रिजल्ट आ गया ना, देख लो.
मैंने कहते भाई पूछ लो कि सो आई विल से दैट जो भी लोग पढ़ रहे हैं कि दे शुड ऑल्सो डू समथिंग लाइक कि वो लास्ट 10 डेज में हर बंदे का एक अपना तरीका होता है पढ़ने का। जैसे मेरे को ये था कि मैं पूरा सिलेबस, बिकॉज एज सर सेड कि आई एम अ फास्ट रीडर, हाँ मैं तेज पढ़ता हूँ, बट कि मेरे को ये था कि मैं सारा सिलेबस पूरा पढ़ूंगा 10 दिन में। कुछ लोग करते हैं कि इंपॉर्टेंट टॉपिक्स पढ़ते लास्ट 5 डेज में, बट यू हैव टू सी इट इन योर इंटायर ईयर ऑफ प्रिपरेशन दैट हाउ थिंग्स वर्क फॉर यू. But I thought that studying whole syllabus once will give me at least confident that I have read enough. I will do great in my exam. Then I went to my Neet PG. I was not worried at all. My father used to say कि यार तेरे को टेंशन नहीं है. मैं कहा हाँ नहीं है, मैं ऐसे ही हूँ. फिर मैं एग्जाम देने गया. एग्जाम मेरे को लग ही नहीं रहा था कि मैं एग्जाम में बैठा हूँ. मैंने बोल ही रहा हूँ कि 2 घंटे 20 मिनट में डन था एग्जाम करके. मैंने अपने लास्ट 70 मिनट्स में मैंने 2 या 3 क्वेश्चंस चेंज करे हैं, वो मेरे गलत हो गए हैं. मैंने कुछ भी नहीं करा. मैं 2 घंटे 20 मिनट के बाद डन था कि क्योंकि मेरे को लगा कि हाँ यार ये सब जो सब कुछ मैंने ये सब कुछ पिछले 10 दिन में पढ़ा है. लोगों लगा था यार पढ़े पता नहीं कब पढ़ा. मैंने कहा यार मेरे को इसमें से 250 ठीक कर रहे हैं. 250 मैंने अभी पढ़े हैं 10 दिन पहले, पर हार्चित कर ठीक होंगे.
So very very important message friends that I want to give you with this particular interview is कि जो आपको क्लास में whatever that has been taught to you in the class that will be sufficient to do more than 250 questions correct. और mark my words friends कि वो जो 50 question है those less remaining 50 questions irrespective of the content that you read you will never be able to do because that paper is broadly an undoable paper. If not 50 then I'll say 30 questions or 35 questions depending on a case to case base. So just trust on to the things that you people have read and more number of topic more close to the exam you can revise, better will be your rank. Any last message that you want to give to the students in 2 lines?
As the general as a people think that it is not possible to do whole syllabus in one year along with internship. These all are just lame excuses. Believe me friends, if you start doing it, then it will in the middle you will think that what I am doing, but as day by day you will read, you will become more knowledgeable, and as you become more knowledgeable you will like to study more and more, because you will think that I have come a long way, and if I drop out from here then whole I have studied will be all waste. So I will like to say कि जो भी बच्चा जो जिस भी ईयर में है जहां पर भी है पढ़ना स्टार्ट करो. बिना पढ़ाई के किसी की सिलेक्शन नहीं होती है. बहुत लोग बहुत कुछ बोलते हैं कि मैंने कुछ नहीं पढ़ा मेरी तो रैंक आ गई, पर ये मैं बता सकता हूँ कि अगर आप लोग पढ़ोगे चाहे विद द इंटर्नशिप विदाउट द इंटर्नशिप विद द कोचिंग विदाउट द कोचिंग जैसा भी है, जो आपके नोट्स हैं उनमें बिलीव करो और सिर्फ वही पढ़ो जो आप. हर बंदे को अपना लेवल सेट करना है कि मैं इतना ही पढ़ सकता हूँ. ये नहीं है कि मेरा टॉपर है कि वो ऑल इंडिया रैंक मान लाएगा मैं तो उस जितना पढ़ूंगा. नहीं, अपनी देखो कि आप क्या आपके लिए क्या वर्क बहुत अच्छे से क्या वर्क करता है और आपको क्या पढ़ना है. बिलीव ऑन इट एंड बिलीव मी फ्रेंड्स, अगर आप वही पढ़ लें आपकी रैंक पक्का आ जाएगी और आपको अपना ड्रीम कॉलेज ड्रीम ब्रांच मिलेगी. नोबडी कैन डिनाई यू कि आप ऐसा. ये बहुत लोग बोलते हैं कि ऐसा नहीं हो सकता है, ऐसा हो सकता नहीं हो सकता. सब लोग बहुत कुछ बोलते हैं, बट मैं आपको सच दिल से बोल रहा हूँ कि ये सब कुछ पॉसिबल है अगर आप मेहनत करना स्टार्ट करें. और अपने नोट्स को कभी मत भूलो. कोई भी नई चीजें मार्केट में डेली आती हैं. वो ठीक है कि आपको 1-2 दिन के लिए तो ल्योर करेंगी, बट लॉन्ग रन में जैसे मैं आपको बोल रहा हूँ मैंने साल भर पता नहीं क्या किया, बहुत कुछ किया, बट लास्ट 10 डेज पता था अर्चित कुछ काम करे ना करे ये कभी धोखा नहीं दे सकते. ये आज तक इन्होंने कभी दिया है ना किसी को दिया ना मेरे को देंगे. एंड इस चीज ने मेरे लिए काम करा और 99.99% ये चीज आपके लिए भी काम करेगी. तो कुछ भी करना, बट गाइस नोट्स पक्का से याद होने चाहिए, तभी आपकी रैंक आ सकती है. नहीं तो पॉसिबल नहीं है इस साल रैंक क्रैक करना. थैंक यू.
Once again a very very big congratulations. It's very very nice message.
Thank you sir.